Okay. Okay, so welcome everybody here. We are the Ayurveda Professionals of Arizona. My name is Melissa Camacho. I'm on the executive board of this organization. It is a nonprofit organization, and we're getting starting with more and more education on Ayurveda, more and more education for our Ayurveda colleagues and for the public. Today we have 5 Chinese herbs to integrate into your Ayurvedic practice. Um, we have here a lot of people, we're not new, but we're new-ish, I would say, in the whole realm of state organizations. And so here we go um, with our website and then email here. That's www.azayurveda.org. And this is our mission. Basically, our mission is to promote successful professional and personal practice of Ayurveda through community education, professional support, and collaboration. Also, want to stress here, this is the latest statement from the executive board. Basically, it's talking about our mission, talking about a vision, but we're also saying, let's be nice to each other. We will not, we're not going to, what does take any bullying in our workshops or our seminars. No one here is going to do it, but this statement is about that. But I just want to say it because it needs to be said. And unfortunately, it needs to be said. So if you have any questions about this, you could contact us. Today, I'm so excited to welcome Josh Whiteley, 5 Chinese herbs to integrate into your Ayurvedic practice. Josh is brilliant. Josh is amazing. Josh is a healer. Josh is a Ayurvedic practitioner, Chinese medical doctor, or what do we say, diplomat of Oriental medicine. He is an acupuncturist. He is a nurse. He is a needler, a moxer, a zoomer, a Rupa Ayurveda-er. Anyone who sees films to die, the Brett Goldstein podcast knows that this introduction is taken from that. So Josh is amazing. He's just an amazing he's an amazing teacher. He also, you might know him from social media, Rupa Ayurveda on Instagram and TikTok and Jyotish. What else? He's Matser, Cupper, RN, Nurser. He is amazing. He has this well-rounded viewpoint of health from an alternative point of view, from the elemental point of view, from the Ayurvedic point of view, from the Chinese medical point of view, from the nursing point of view. Yes, overall, amazing person, amazing practitioner, amazing Tucsoner. This is Josh Whiteley, and look at him. You can see that you could contact him if need be at his clinic, at his place, Common Roots Acupuncture in Tucson. Here's his email here, hi@commonrootsacupuncture.com. He'll probably give you some more information on other ways to get a hold of him. He is all over the place. Look at that picture of Josh. This is just like a smidge of what he does, of what we're going to talk about. This is a smidge of what he also does Jyotish, and he also talks at length about Jyotish. And so here we are here capturing him in 2005, was it? 2005,
Yeah.
20 years ago. I've known Josh over 20 years. Oh my God. And look at him, looking all professor-like this is at the Ayurvedic Institute, and we are discussing Jyotish and planets and everything here. We're so lucky and so honored, and so I'm very amazed. We're so happy to have him. Josh Whiteley, I'm going to stop share so you can share. Thank you for being here, my dear friend. Thank you,
Thank
thank
you,
you.
Melissa. That was amazing. Thank you all for having me here. I also want to share about that picture, a funny thing. So that was at the Ayurvedic Institute. I was not doing Jyotish at that time, and I thought it'd be really funny to take the picture acting like I was teaching Jyotish, having no idea that that would become like one of my dear passions not too much longer after that. So
Right. Well, it was that year they actually Dr. Ladd is known to go like in and out of Jyotish. That year, our year, he was pretty deep in it. So we got
really,
a lot. He was planting a seed for sure. And look at,
absolutely,
yeah.
absolutely. All right. Well, thank you all for having me here. I'm happy to be here and support this great organization and help just promote Ayurvedic medicine and just the advancement of our profession. And I'm a big advocate of integration of all of these things. And I try to be careful where you don't want to dig, there's this saying of like you want to dig one well very deep and not just dig a bunch of shallow holes in the ground. However, I think it's still good to reach out across and look and start to integrate some of these ideas and some of these. Today, we're going to talk about herbs and just, find ways to help complement our practices, especially as Ayurvedic practitioners in the West. We all know that we're working on building up educational frameworks and structures to really help us be good clinicians and that type of thing. So the more we can understand about these things that are within our scope to use and things that will help our patients more, I think is always a great thing. So I'm always happy to expand my own education, and even doing this workshop I think really helps me understand some of these herbs better. So it's always fun for me to do this too. So I appreciate y'all joining me. I'm gonna share my screen here if I can figure it out. Oops, I don't think I hit share. What did I do?
Do you have it?
I mean, I'm hitting the share, but oh, I see. It came up
You
now.
got it. Okay.
I got it. I had to put it on multiple. Okay, hopefully y'all see this, but let's put it in presentation mode. And I should probably start at the beginning. Okay, do you guys see that okay? Okay. So this is our workshop for today. It's 5 TCM herbs for the Ayurvedic practitioner. Um, Again, I think we have such a basis of good clinical information with Ayurveda, and it's its own medicine system in and of itself, of course. But there's a lot of things I learned about going through Chinese medical school about some of these particular herbs that I think, I don't know if fill in the gaps is quite the right word, but they really help to like fill out the picture of some things we treat. So there's some superstar herbs that I think would be really useful to start to know. And I also want to say that we have like about an hour here today, and this is a giant, vast subject, so I'm going to try to keep it as like succinct as possible without like letting go of too much substance. But it is a bit of an intro, but I still think we can get a lot of depth. So there's a few of these like superstar herbs I really like that I think would really complement your practice. So if we start on this, Melissa already talked a little bit about me, so I won't spend too long here. But these are just kind of the things I've been into and interested in. I've always borrowed this line from our teacher, Dr. Ladd. I'm a chronic student, so school seems to be a big theme for me. It's always just, I'm always looking at other programs and ways to go back and keep learning. So, Ayurveda, of course, at the Ayurvedic Institute with Melissa. And from there, it kind of branched out and got really into Jyotish and Vastu. And so I studied that a lot. And a lot of my practice is really based around that these days. Um, Went to acupuncture school at Southwest Acupuncture College in Boulder, primarily to do a lot of clinical education and just like get that experience. And then, of course, fell in love with acupuncture and Chinese medicine as well. And then I've also gone through a nursing program. I was worked in the ER for a while, and then switched over to hospice and palliative care for a while. And I still do that. Sometimes I do it PRN these days, so it's much more of like a minuscule part of my work existence. But these are all the different hats I tend to wear. Just as I live in Tucson, I have my private practice here. I have my acupuncture clinic is a 501(c)(3) nonprofit called Common Roots Acupuncture, and I like to teach a lot. So it's been a couple of years, but at the Arizona School of Acupuncture and Oriental Medicine here in Tucson, I serve on the adjunct faculty. Before we start, I always try to do a little chant. So if you know this, go ahead and chant with me. If you don't, it's okay. You can just close your eyes. So always chant to Ganesh is a great way to start any type of teaching, and always chanting to your gurus is always going to be helpful to make the endeavor go better. So Guru Brahma, Guru Vishnu, Guru Devo Maheshwaraha, Guru Sakshat Param Brahma, Tasmai Sri Gurave Namaha. Tasmai Sri Gurave Namaha. Tasmai Sri Gurave Namaha. Okay. So this is just kind of a little bit of a rough outline what we'll be going through today. We're going to start with our 5 TCM herbs. These are them: Huang Qi, Dong Gui. Oops, I didn't change that one out. We're not doing Chuan Chong. Swanza Ren and Cordyceps. And then after that, we'll get into some of the translations. So I really did my best to kind of figure out how we can take this TCM terminology, which often is quite different than Ayurvedic terminology, but there's a lot of parallels. There's a lot of ways that we can, translate these ideas into terms that make sense as an Ayurvedic practitioner too. So we'll get into that. And then we'll talk about some of the safety, so indications, contraindications, safe dosages and medicinal dosages, and then just a couple like practical formulas that we can use to start to integrate these things. And then I have some case studies from some patients of mine that I kind of expand on. So we'll start to see how these things play out in like real life, day-to-day patient stuff. So it's always good to learn these things like in the book and learn what in theory is going to happen. But then of course you get into real life and you see the patient in front of you and then you go, oh my God, it's not what the book said it was going to be. So that's where the real like art and science kind of joins together with creating herbal formulas. And I'm sure most of you guys have built your own formulas too. It really certainly is an art. It's a difficult concept to like learn, or it takes time to kind of master it. And you'll have teachers tell you one thing and the next teacher tells you something totally opposite. So it's something to play around with, but I wanted to at least set up some kind of base formulas we can work from and use as kind of a structure to see how you can integrate these herbs. And then if we have some time left, we'll dive into some like Q&A type stuff, or just we can expand on what we're talking about today. So these are our 5 herbs. We got Huang Qi, which is often known as astragalus, and we have Dong Gui, Chinese angelica root, Yuanzi, which is polygala root, Swanzaren, which is ziziphus, which is such a great word, isn't it? And Dongcheng Xiaosao, which is cordyceps. So um, the reason I picked these specific herbs is for a couple of reasons, but one is about availability. So we'll get into that a little bit later, but just things that are able to be found. And we'll talk about some of the dynamics with like licensure and things like that. So I tried to find some ones that would help in that way. I find some herbs that were translated well into Ayurvedic language. Some of these things like it's a little bit of like, using your detective hat to kind of figure out like what that means versus what it means in TCM. But I tried to find the ones that made sense there. And then I said it earlier, but the things that to me kind of serve a nice purpose where, not that Ayurveda doesn't have the tools to treat most anything, but the ones where these kind of like rock stars will really shine and kind of help out formulas. And then, yeah, and then safety also, is a big thing. Sometimes I think herbs get talked about as if they're just this ultimate panacea that has no interactions or is completely safe to use and no problems, and it's not necessarily the case. So I try to find some ones that also have a pretty good buffer window, but we'll definitely talk about some of the reasons in areas you need to be careful with. So before we dive into the herbs, we've got to have a little bit of background information. I'm trying to really keep this as simple as possible without like putting too much on your plate. It can be very overwhelming. It's a whole nother system. When I first started learning TCM, in full disclosure, I almost dropped out my first semester because I went, this just doesn't make sense to me. The Ayurveda principles, just I was like, I had those so ingrained in me and they made such perfect sense. They like flowed so well for me, and the TCM stuff was just a little more tricky. But once you understand it and get it a little better, you see the beauty in it and you see the kind of integration piece. But so there's a couple primary principles I want to talk about, and this is where we'll see some crossover too, where there's a lot of similarities between Ayurveda and Chinese medicine. One big thing we always look at when we choose herbs is going to be their temperatures. So we have herbs that are hot, herbs that are warm, herbs that are cool, and ones that are cold. So this, translates really well into virya in Ayurveda. So this is just the temperature effect that an herb's going to have on the body, how it's going to influence metabolism, circulation, and elimination. So one good place to start is by looking at that. If we have a really cold condition, do we want to go with a really cold herb? Probably not, right? So that's where the beauty of Ayurveda comes in, right? Where every herb is specific to the patient that you see in front of you. There's not a one size fits all. Very similar concepts in Chinese medicine too. So we have our four temperature qualities. They also have the five tastes in Chinese medicine. And this tells a lot. Again, we know how the tastes affect our bodies in Ayurveda. And it's very similar with Chinese medicine too. So there's acrid, which is like a pungent kind of flavor. This tends to move qi or prana. This is a really important concept in Chinese medicine. A lot of things boil down to, whether it's acupuncture or herbs, about movement of qi throughout the body. So acrid does that very, very well. Bitter is drying or draining in nature. This is slightly different, I think, than how we tend to think of it in Ayurveda. But usually when there's excessive fluids in the body and things like that, pustules and things like that, we really implement like a bitter flavor for that. And sweet, of course, is very similar. It tonifies things, and sour astringes, and salty softens hardness. Ayurveda uses taste in the same way. So we have the flavors that we know: Madura, Amla, Labana, Katu, Tikta, Kashaya. And Chinese medicine also implements some of these very similar ideas. It's a little bit getting into the weeds, dig into the flavors, precisely of what they do and how they differ from Ayurveda. It's like a little beyond an hour, but just know that when you're looking at an herb and trying to determine whether it's going to fit in the formula well, try to have an understanding of what's going to be happening. Is it going to be more of a moving herb? Is it going to be more of a draining herb, or more of a tonifying herb, etc.? And these are all concepts we understand well in Ayurvedic medicine. And we have our 12 primary meridians. So lung, large intestine, stomach, spleen, heart, small intestine, bladder, kidney, pericardium, sanjiao, gallbladder, and liver. These get grinded into our head through school. People often ask me, how do you remember all these points and all these things? It's like, it's just repetition. You just grind, grind, grind. So, but understanding the primary meridians is important also in herbal medicine, because it shows the effect, or the focus of the herb and where it's going to be directed in the body. So whether you're targeting the lung or the liver or something like that, you're going to have a sense of what that herb will affect on an organ system level. So similar in Ayurveda, when we look at something like the lung and we tell a patient like, oh, your lung pulse is weak, right? We also have to sometimes translate for them, right? Because then they immediately freak out and think like, my lungs are falling apart, or what's happening, right? We have to think of these as organ systems. So it's more of a systemic effect on the body rather than just a specific organ itself. So same idea in Ayurveda, right? There's a lot of translation of some of these ideas. So like the lung, for instance, has a lot to do not only with respiration and that kind of thing, but also like the down bearing of qi through the body. So if the lung's not functioning well, things don't move downward through the body, right? So this is why that congestion gets stuck in the body. So this, I think, applies quite well to like looking at dhatus and things like that in Ayurveda. So think about the meridian entry points as like organ systems and dhatu entry points. So we'll pick this apart a little bit more so it makes more sense. But and herbs are always used in synergy. So it's not really common to take an herb in it by itself. And they're often built into these formulas. And I think the Ayurveda in the West gets a little bit simplified. We build these formulas that are maybe just a couple of herbs. And I see a lot in the Indian formulas, like there'll be a much bigger herbal formula, and very same thing in Chinese medicine too. So a lot of formulas, not all, there are some simple ones too, but tend to have upwards of 8, 9, 10 herbs in them, and that's because they have a synergistic effect with each other, right? So there'll be herbs that will treat the primary disease, which would be the chief herb in Chinese medicine, and then you have what they call a deputy, and this tends to assist the chief herb, so it kind of like fills the holes or whatever the chief herb is not quite getting. And then you have an assistant herb, and this tends to like moderate any harsh qualities of the herbal formula. So let's say you need that hot herb, but this person's also really hot, but for whatever reason, it just makes sense. You will have a very cooling herb in there, right? Just to kind of moderate or modulate that. And then the envoy herb, which is about which channel it's going to be directed to. So that would be your 12 meridians, right? So same idea in Ayurveda. We're looking at very specific herbal applications to the patient, and you want to kind of hit things from different angles. So we do the same thing. So generally it's best to use these within the context of an herbal formula, but sometimes, a single herb can make sense, or 1, 2 herbs can make sense too. So it's not a hard rule either. Let's see, roots and branches. So in TCM, we don't prescribe herbs based on symptoms or disease name alone. We know this already in Ayurveda, right? Everything comes back to what they call pattern diagnosis or differential diagnosis. And we arrive at that through auscultation, through questioning our patients, just for observing the body, palpation of the pulse and the meridians themselves, tongue diagnosis. Just like in Ayurveda, we have these same kind of diagnostic techniques. Some of these are a little bit different in how they approach it, in Ayurveda, we do look at like marma, so we do feel the body and things like that. But I think that this system seemed to get, at least in my experience, much more refined about channel palpation and using that as a diagnostic technique, which is, I think, is one of the big strengths. I didn't put it in these notes, but there's a great book on channel palpation that's just so helpful, even in an Ayurvedic context, I think, for understanding what patterns are happening in the body. So that might get missed, I think, a lot in Ayurveda for us is like, but putting your hands on somebody's body and on their even their feet and their legs and their calves and their arms, and you can learn a lot about diagnostically what's happening for them too, not just necessarily pulse and tongue, which we tend to go towards, which are amazing tools as well. But palpation is a really neat tool to use too. I listed a couple common TCM diagnoses and their symptoms just to like start to learn this language a little bit because the herbs we're going to talk about will get into this. But spleen chi deficiency is probably the most common Chinese diagnosis you'll hear. It's also the running joke amongst acupuncturists because everybody has spleen chi deficiency, right? And so sometimes your patient will say, "My acupuncturist told me I have spleen chi deficiency," and it's like just kind of a funny thing because it's like, yeah, that's life. We all have spleen chi deficiency, but it's a TCM diagnosis. It's very common. And I think it relates a lot to Ayurveda, and this is very connected to our Agni, especially like Jatra Agni specifically, right? So this is about how your body's processing nutrients, assimilating nutrition into the body, all those types of things has to do with the spleen function. So think of the spleen a little bit like a pancreatic function, pancreas and stomach kind of idea where this is how we process food, take in food, and absorb. So when you have spleen chi deficiency, these are some of the most common symptoms you see is usually low energy, weak metabolism, loose stools, just heavy, sluggish feeling. You can get kind of edema in the body and that kind of thing, right? So we can connect this as like Manda Agni, Ama vitiation or Ama creation in the body, Hai Kapha, all these type of things will relate very closely to like a spleen chi deficiency diagnosis. Um, Blood deficiency is another very common pattern diagnosis too. These are some of the main symptoms. You'll see dryness and dizziness and fatigue. Menstrual issues are usually a very common thing that people come to see us all for, right? So this is usually a big thing to look at is like the state of the blood. So in Chinese medicine, they pay a lot of attention to the blood. I know in Ayurveda, I think it's not the Ashtanga Hridayam, but I think in Sushruta, he does talk about there's this idea that blood might be a fourth dosha, which is kind of fascinating, right? I have this big kind of interest in blood, so I should probably do some more digging into that.
Yeah, it
But
is true. Yeah,
it's
that's right.
Sushruta. Okay, okay,
Yeah.
yeah, and it's just another fascinating thing to look at and very common way to treat patients is by treating the blood in Ayurveda. Sorry, guys, I talk very fast. Just if anybody needs to jump in, let me know. Sometimes I just start rambling. Um, what was I going to say about it? See, now I forgot. See, my vata's already gone. Oh, right. In Ayurveda, right, we do tend to treat a heavier clientele of vegetarians and vegans, I think, than we probably do in Chinese medicine. Blood stuff is big in this case, right? So when I was in acupuncture school, I was a vegetarian, and so I was always fat, and I had a lot of vegan friends. So I was always fascinated about how do we build blood in a vegetarian vegan context. So there's a lot of great tools I think that some of these herbs we'll talk about have to offer us as Ayurvedic practitioners for building blood, and it's not really a concept that we talk so specifically about. I think in Ayurveda, maybe in different language or something, but. Um, Anyway, liver blood stagnation is another, or liver chi and blood stagnation is another big one. And this is where we get a lot of like the menstrual issues, especially. So irritability, cramping, um, you know, um, um, heavy flow or lack of flow or clear flow or clots, all these kinds of things, right? So this has a lot to do with disturbed vata and disturbed pitta. So again, this is one of these concepts that doesn't quite translate quite well, but this vata and pitta together creates a lot of these like liver or blood or wood element type issues. And then we're going to talk about heart shen disturbance too, because this is, again, another really common thing and something we can really shine in helping people treat. Anxiety, insomnia, restlessness. I correlate this with like Sattva Pitta type issues. This will be a big one we'll talk about. And then lung qi deficiency. So low immunity, shortness of breath, coughs, spontaneous sweating. And these are about pranavata kashaya, oja kashaya, these ideas too. So anybody have questions so far? Am I doing okay? Not too fast? Okay. I made this little fun graph because who doesn't like a little fun graph? Just to translate some of these ideas so they make a little more sense. I could probably get some angry people at me for saying this, but chi and prana have essentially are correlated as similar type, I guess, substances, so to speak. But even the idea of chi in Chinese medicine is very like controversial. There's schools of thought that feel chi is purely like kind of this energetic thing in the body. There's schools of thought that think no, it's actually just oxygenation of tissue. They go back and forth forever and ever about this. But I think long story short, we could say that qi and prana are essentially the same idea. Blood in Chinese medicine has to do with rasa rakta dhatus. This is where we look at things like treating some of the blood deficiencies and I think where we can really shine with some Chinese herbs in this case. Yin is essentially kapha, essentially ojas at the refined level. Yang is pitta, agni, and tejas. The meridians are like the nadi system in the body. The meridians are a little more, I guess, formulated or structured, I think, than the nadis. Like, I know there's some primary nadis, but there's 72,000 of them. So I've never seen any text that people have categorized every single nadi. So the meridians maybe are a little bit more of a refined or, I don't know if refined is the right word, but formulated system. And then the acupuncture points themselves essentially are similar to like the Marmani. So those are the basic translations I think that are helpful to understand. So when you're reading a book about Chinese medicine or something like that, or the herbs, you can at least say, okay, if this is a yin tonic, I know we're looking at like kapha ojas. If we're looking at qi tonics, we're thinking about prana deficiency in the body, right? This kind of thing. I said this a little bit already, but entry into the meridians themselves has a lot to do with targeting dot-2 and organ systems. And then the action of the herbs, which is a big term they use in Chinese medicine, has to do with the effect on the dhatu, the effect on doshas, so whether it's going to increase pitta, decrease pitta, increase kapha, etc. And then just the clinical indications. Did he stir? Okay, good. I just want to make sure. You need a good visual. Okay, so finally, all that blah, 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 and here we are. The first herb that we're going to talk about is Hong Qi, and it's known as astragalus. This is one of the common ones that you can find if you went into the grocery store, or not, maybe like Sprouts or Whole Foods or something like that. You can usually find astragalus. It's had a big enough name at this point that it can be easily found. So wonderful, amazing herb. I'd love to hear Melissa's thoughts on it too. But this is a common. The reason I like Huang Qi so much is that this comes, like I was saying earlier about treating the spleen as a way to be correlated with treating Agni in the body. This has a lot to do with keeping the digestion strong. So there's a school of thought in Chinese medicine, the Pi Wei Lun. I don't remember the author's name, but this is essentially the school of spleen stomach. And we could say this is probably the closest correlation to Ayurveda we have in Chinese medicine. So everything came back to treating the spleen and the stomach. So if there's any problem in the body, start with the digestion, right? Start with the Agni, start with looking at that, and things tend to fall in place. If they don't, then we can further refine, right? But Huang Qi is a wonderful herb to do that because it so strongly tonifies the spleen. It's sweet, slightly warm in nature, goes into the spleen and lung meridians, and it's a qi tonifier is the category that it falls into. What's beautiful about it is that has that adaptogenic nature about it too. So it tends to help modulate the body. So if your nervous system, if you're tired and sluggish, it'll tend to bring you up. If you're running high on anxiety, it tends to like bring you down. So very wide range of applicability, I think, in Ayurvedic formulas. And being it's a chi tonic, but it also strengthens the Agni, means we can like tonify the body without kind of, sometimes you give these heavy, like a lot of ashwagandha, right? Or shatavari, these like kind of heavy or cloying herbs, and the body just can't digest it, right? So people get gassy and bloaty and they just feel like crap, right? Huang Qi is a wonderful way to like strengthen the fire in the body without overheating the body, which sometimes the like yang tonifiers will do. So beautiful herb. Focuses on rasa, mamsa, meta, Dhatu's controls of Panavayu. This herb is really commonly used when people have chronic fatigue, have weak digestion, nausea, vomiting, colds, congestion, edema, diabetes 2 support, and prolapse. So this is probably the most, I don't know, I guess kind of rock star thing about this. So if people have prolapsed organs, this helps to lift chi essentially, right? So it moves things upwards. This is also good to use when people are pregnant and are at risk of having pregnancy loss. Getting somebody on Huang Qi or having Huang Qi in your formula can be really, really helpful to help support maintaining pregnancy. So that's I almost always go towards this if I'm looking at that type of patient. But you can see some of these indications, right? What does that look like? Low Agni, right? Manda Agni, something like that. Um, Generally well tolerated. I haven't seen a lot of like stuff come up with people as far as, but some indications are potentially rash or itchiness, diarrhea. Um, if if the mom is pregnant and breastfeeding, there's just not a lot of research. This is very commonly used, but I'm just throwing it in there as a caution. And I say that with almost any herb. If somebody is pregnant, just be careful. Feel like you know what you're doing. Do your research on it. Make sure it's not going to like contraindicate in any way. Um, but again, this is such a commonly used herb to maintain healthy pregnancy too. That I don't think that pans out, but there's not official research on this yet. Um, there's a note about immunosuppressants and hormone sensitive cancers as well. Immunosuppressants, of course, are when sometimes people are getting meds to like an autoimmune diseases where they need to like squash the immune system so that it doesn't have that hyperreaction. Huang Qi tends to lift up the immune system, right? So we got to be careful there. And then hormone sensitive cancers. Again, there's not a lot of research on that, but there is potentially some phytoestrogenic properties about Huang Qi that we need to be mindful of too. So this is usually like breast cancer, uterine cancer. I'm trying to think if there's any. What are the other big ones? No, those two main ones I'm thinking of. If they have those, they may be hormone sensitive cancers, and we want to avoid anything that might potentially increase the estrogen effect in the body. Um, I put the dose here, so 3 to 9 grams a day is like the official dose of it. This is something I think in Ayurveda we can really learn from Chinese medicine too, is that we tend to really underdose, I think, in the West with herbal medicine. So 3 to 9 grams, you know, you always do start low and you want to check patient tolerance and you can adjust from there too. But doing up to like 9 grams a day would be totally warranted and depending on how, you know, how many of these symptoms this patient's having or the state of their pulse and that kind of stuff. But just keep that in mind. That's about the range. We're going to do a case study in a minute. I'll show you what I did. But that's a big thing I feel like I've seen a lot and when we order some of the supplements and Ayurvedic supplements is that they're pretty underdosed if you want to be treating somebody medicinally or clinically for something, right? So they're fine if it's just kind of a um, you know, something for their constitution, right? Or just something to help them feel better. It can be a low dose like that, but doing like 500 milligrams a day is not going to be enough, right? Like if you're trying to make some big change in the patient. Do you have anything you want to say about this one, Melissa?
Yeah, I was gonna say this is helpful for kids. This is one of the ones where I say with for moms because it's so readily available in like Whole Foods and natural grocers or something that it's a good one at the beginning of the school year and in a glycerin or in the powder form if you can. It's one of those things where it's like yeah, in and of itself, just it alone is helpful for kids. And we don't need anything too complicated for kids most of the time in herbal medicine. But this one is one that I'll often say to my mamas at the beginning of school years to the school year to give to their kids, or if something's going around. So yeah, I actually utilize this a lot with kids too.
Cool. That's really cool. I remember that one. Yeah, and it just like it tonifies the immune system in the way, right? Because if you know if we strengthen the Agni and keep that strong, we tend to not get sick, which is great. That's cool. Thank you. Um, and here's our little case study. I don't know if my screen's blocking that, but let me just move. Okay, so I got Jenny here. It's not a patient's real name, but we got Jenny. And 42-year-old female with post-viral fatigue, low appetite, crashing out, mild edema, depressed, and gets sick very easily. So kind of like what Melissa was saying here, right? Um, had her come in, and of course, like the patient will tell you what they're there for, and then you always ask more questions, right? Because you always get more to the story, or there's just things they don't realize would be relevant to the story. But for her, she had alternating loose stools and constipation. Sometimes she get mucus in the stool. This is usually with like the loose stool. And like a rock feeling sitting in her stomach, gassy, tired after meals. These all point towards, in Chinese medicine, which we call spleen qi deficiency. This is like a very black and white kind of, textbook example of that. This could also point towards like a Munda Agni type situation in Ayurveda. Got her tongue here is pale, swollen, and teeth marks, ridges, thin white coat. I think that all translates okay. I think a lot in tongue and pulse in Chinese medicine, so I hope that makes sense in Ayurveda too. I think it does. But you can see very pale, kind of swollen tongue. She's got the teeth marks on the side, which shows us malabsorption of nutrients. And then like a pretty thin white coat. Actually, it's not too terrible, and a little bit like kind of a like wet kind of look to it, right? So she's got a very spleen deficient, Agni deficient tongue there. So we know that we need to strengthen that. We need to fire up her digestion. In Ayurveda, to me, this is like Vata pushing Kapha in the GI tract. So there's like this irregularity in the Vata movement. Things tend to stop. That's like that rock in the stomach feeling. So the things aren't passing through. And then as things get backed up, we accumulate more Ama and toxicity in the body. Her Agni's low Rasa Dhatu, has to do with like the coloring of the tongue, the absorption of nutrients, and depleted Ojas in general. So that's more of like a long-term, I think, thing for her, or like a bigger picture puzzle for her. And then early signs of prana or Viana fatigue. So that again, that circulation of the body, the ability of fluid to drain and not accumulate in the limbs, that type of thing. And then with this type of stuff, depression is very common too, right? Like as our physical body gets stuck and sluggish and stops, we also get depressed and mentally, emotionally sluggish and we stop, right? So she's a good candidate for Huang Qi. I made a very simple formula here for her, and some of it's just also for our reference, but we have Huang Qi as our primary or chief herb in this case. So this again, this is at the low end of normal, right? So we said 3 to 9 in a day is the dosage range. So when we're doing 3 twice a day, so she's getting 6 grams total. Maybe that's, I guess, more of like a moderate dosage, I should say. But she could certainly go a little bit higher than that. Ashwagandha I have in there as a secondary herb because we know the properties of ashwagandha and what it does with tonification. I went a little bit lower on that because we're going to use the Huang Qi as our main engine. And then Shatavari, just because, she's with female and menstrual stuff. This will really help to keep things moving, keep the bowels, regular without overdoing like kind of the, laxative effect with her. And in her case, I really like Pipili. Pipili is like a fire rocket, right? Like we gotta be really careful with it, but it does work really good if you get just the right dose and the right amount and don't overdo it. But wonderful for upping Agni, wonderful for upping lung support. And Chinese medicine, those are the two systems that are very connected, lung and spleen. So we're always looking at that. And as an Anapan, I just have her take it with warm water, ginger tea, just and also again to help aid digestion. So you can see we're doing a couple things. I mean, we got some tonics in there, right? We got ashwagandha, we got shatavari. Those can be a little bit heavy, but the power of Huang Qi is going to help that to digest, that to work okay. Especially if we throw some pipili in the mix too, she'll be able to actually take in the tonic effects of the ashwagandha and shatavari without it being too cloying. Anytime you give herbs though, right, you start and you see how it goes and you go like this and you make your, best guess on what's going to be the right thing for her. And then you have her check back in and we adjust as needed. And also if her digestion gets better, right, we might be able to even up some tonic if we want to or need to. So you're always kind of playing with this formula a little bit and adjusting as needed. And then I just have some of the logic here. Huang Qi rebuilds and stabilizes. We didn't talk about Wei Qi, but this is like your defensive Qi. This is what Melissa was saying actually. So like you don't get sick, right? Your Wei Qi is like your force field. Reduces fatigue and lingering edema, so it helps to dry up a lot of the fluids, and it's an adaptogen like we talked about. We know about ashwagandha for strengthening vata and restoring vitality. We know about shatavari to support ojas and hormonal balance, and of course we know pipili and its effect for mucus and absorption and the fatigue from all the Ama. And then I just put a couple notes. God, I have to figure out how to make this smaller, I think. Is my screen where it shows like all the faces blocking everything for you guys, or is that it's okay? You guys don't see that? Okay.
No.
All right. I just want to make sure it's not in the way. Clinical insights. This trio works like a Qi Prana Ojas rebuilding formula. Huang Qi helps to integrate heavy tonic herbs, like I said, effectively. The adaptogenic nature of it is also just great for the nervous system and the mind. It helps, like I said, if you're too anxious, it helps to bring you down. If you're too depressed, it helps to lift you up. And then I put Buzhong Ichitong. This is the Chinese formula that's, there's some primary Chinese herbal formulas, and Buzhong Ichitong is the one that contains Huang Qi that's usually given. So in a formulaic context, Buzhong Ichitong would be a good fit in this case. Um, but yeah, I gave her this and she did really good with it. We didn't have any problems. I was thinking a little bit about some of these tonics and I was pushing my luck a little bit, I felt like, but I thought, you know what, that Huang Chi is going to do it. And it did the trick. It was very good for her. Um, yeah, that's this for me. Do you guys have any questions about it or anything? Or any comments?
So initially, Josh, how long do you, what is your like your upashaya time in terms of like how long do you put them on and you just do you do the 40-day thing and then the 3 month thing, or do you
I mean, I
just
try and check in sooner than that. I mean,
yeah.
especially
Oh,
like when I start the formula, like I mean, even by the next week, I'll be like, like, I mean, I'm usually trying to see them for appointments too, and integrating acupuncture and that kind of thing. So, like,
yeah.
I have probably a little better window of getting to see them. But once I feel like we're coasting, we're doing totally. I like 30 days, and then let's
Mhm.
check in again and see how we need to adjust. And I always tell patients too, like, if see how it goes. These are very safe herbs. If I know of any potential side effects they might feel, like in this case, I would say like, if you feel really bloated or just worse, or it's like just either reduce the dose or stop it and give me a call and let's talk it through. So, give them a little bit of leeway and heads up to like just pull the plug, pull the
Yeah.
ejection button if they need to. But yeah, once you get sailing, I'm sure you see the same thing. I like about 30 days and then probably adjust something in there.
Yeah.
So. But at 40 is great, right? That's like our traditional Vedic window. I use that a lot with Vedic astrology stuff. It's like 40 days, 40 days. Okay.
Yep.
Next herb is Dongui, Dongquai. Sometimes it's written as. Again, this is another one I chose not only because it's just such a powerhouse, but it is able to be found. I've seen it on the shelf and sprouts and things like that. You can get it pretty easily. So this is a very commonly used herb, and this is the one I was talking about where when we're looking at blood building and blood moving and things like that in Chinese medicine. You'll see this one in almost every formula because it just does such a great job of that. It's sweet in nature, acrid and warm, enters the heart and liver and spleen meridians, and it's a category as a blood tonic. So, in Ayurvedic terms, this is going to nourish or rakta dhatu, helps to reduce vata, helps to it's moderately heating, so it's going to raise pitta a little bit, and it alleviates stagnation. Is like its probably big powerhouse function. We talked about the dhatus it enters, can tonify ojas, and regulate Vyana Vayu too very well. So blood deficiency, which isn't a term we use in Ayurveda, but very commonly used in Chinese medicine. We can look at anemia, so even blood work and things like that will show when they're anemic, there's good likelihood they're going to be in blood deficiency category. Menstrual regularities and menopausal symptoms are the big thing this usually is going to be in a formula for. Isoneuropathy, I don't really necessarily think of it in that case, but it makes sense. It's a circulator. It helps to move chi and blood and prana and all that kind of thing. Palpitations, constipation, dry skin, itchiness. These are all blood deficiency type symptomology. So we can look at that as like vata in rasa and rakta dhatu especially, right? Um, Again, pretty well tolerated. I don't see a lot of issues with it when I've given it to patients. Sometimes bloating, but that's the main thing I've ever seen with it. You want to be either you probably just want to say don't give it in pregnancy. You can give it in pregnancy, but because it is a moving and stimulating herb, we don't want to do anything that could potentially, affect a pregnancy. And just as important, cover your own butt and not have somebody come back and say you did this, right? Same thing with the hormone sensitive cancers, and then blood thinners is another big one. So I've never had a big problem with excessive bleeding with this, but if they are on blood thinners, you either want to go a very small dose or maybe even just think about not including it in a formula because it could potentiate the effect of it. Um, 3 to 12 grams a day is the suggested dosage range of this, and you adjust, of course, based on the condition and patient tolerance. So here's our patient. So we got Beth, 35-year-old, painful periods, fatigue, dry skin, irritability before her menses, mild constipation. When I talk to her, occasionally we'll get dizzy, that like especially the orthostatic hypotension when you get up too fast and you feel like you're gonna fall on the ground. Um, Eats minimal amount of meat, so she was largely vegetarian. I think she did eat some fish, but not very frequently. And always has cold feet and passes small clots with her cycle. So looking at her tongue, we can see it's like pale, it's got some redness, but it's more of these like dot redness things, which in Ayurveda we see as like a rasa dhatu issue. So there's some heat in rasa dhatu, but it's also a very pale tongue. And then the pulse itself was very thin pulse, meaning I guess it'd be more like a vata pulse, slightly wiry, which is going to suggest vata stagnation and things like that. There's a little bit of pitta with that too, with a wiry pulse, and then weak in the liver and gallbladder position specifically. So this is a very clear picture too of needing to tonify rasa rakta dhatu when they're deficient. Vata aggravation in the pelvis, so there's lack of movement or irregular movement in the pelvis. With her menses and mild Ranjaka Pitta deficiency, so this is connected with the liver, and then a little bit of constipation, which in Chinese medicine would show just like blood deficiency when you get that constipation that's dry. So I built her a formula with this. Dongui as being kind of our chief or main herb. I did kind of right down the middle of the road again, so 3 grams twice a day. We did some shatavari, which we know is great for this kind of stuff. And then musta, which we also use in Chinese medicine too, is great for helping to just push the bowels and keep things moving. This is like a qi stimulator, qi circulator in like the middle jiao, or sorry, I'm getting too Chinese, in the abdomen, I guess. Um, I didn't add this, but you could potentially put some like Purnanava or something like that just to help with the pelvic circulation as well. And I have her taking that with warm water or pomegranate juice when she's feeling really like fancy. And again, these are like ways to tonify and stimulate the blood. So I try to keep my formulas like the way people take them as simple as possible. I'm the worst at it myself, so I don't put too much pressure on people to like make these big elaborate 2 hour long cooked herbal things. Some people do really well with it and love it, but I try to keep it real simple. So warm water to me is always a great anupam. It's like better to do it and just get something in you than try to do really fancy, boiled milks and things like that. Sometimes people just won't end up doing. But pomegranate juice is pretty tasty, so I thought that'd be a good one that would help her too. And basically, same thing I've just said. We're just nourishing her blood, moistening the bowels, and softening the vata in the pelvis, so that's helping to keep the flow nice and free and moving well. And then shatavari to build the rasa, support her reproductive tissue, and musta to support her liver and that liver constriction, which is where that feelings of irritability before menses. That's like a liver qi stagnation problem, right? So Dongui and musta both do an excellent job at helping with that. Common pattern in vegetarians, again, this is why this herb can be so wonderful, I think, for us as Ayurvedic practitioners to integrate into our practice, because we see a lot of that. I'm a big fan of twisting poses, yoga poses, especially to work on liver chi stagnation, which this pattern is. Any of like even just laying on your back on the floor and doing side to side, it feels, I get this. So liver chi stagnation, that's like the best feeling pose there is. So anything twisting poses, are also really helpful homework they can do. And always look at their lips and their eye conjunctiva and things like that too. You can get signs of seeing how their blood is in their body. So if you see that paleness in the tongue, you see the paleness in the conjunctiva, even the nail beds, right? These are all signs that there will be in Chinese medicine blood deficient or rasa rakta kashaya or something like that. So look at that sign, you'll get a sense of how deep they are into that, and you can tweak your formula a little bit more for that too. Similar idea to and that this is a little bit tonic-y, so you got to like watch sometimes the digestion process of that. So you may decide like, you know what, I know we said warm water, but we really need something stronger for that anapana, or they're not going to digest it. So again, tweak it to your patient a little bit. Okay. You want to add anything, Melissa?
Um, No, though it's so
Put you on the
helpful for
spot.
women. All over women's health. This is the one. Like this is the one that we integrate, and this is like it's so helpful perimenopause, menopausal, even postmenopausal, especially if the female has been just like running their kidneys, like kidney adrenal burnout. Yeah, this is a 5-star for me with with women's health. It's just all over the place with women's health, and it's so easy to integrate. And again, there is, and again, part of the idea of doing this talk in general was the idea of, okay, what is going to be what are herbs that are easily accessible? What are herbs? And this is one of them because it's been highly studied as, along with Wang Chi. They both have been
Yep.
really, there's a lot of research behind both of them. But this one, for me, I would say for women's issues and integrating into formulas, just it works. It
Right
just
away,
works.
right?
Yeah.
Yeah, totally, totally. You just summed it all up like way better than I did. It was great. Just use it. It's good. It's good for women's health. It's so good. Okay. How are we on time? Oh man, we're going. Okay, I'm gonna try to pick it up a little more. I'm sorry, guys. Um, so we have Yuanzi. This is another herb that I really like, and I think is like one of those superstar herbs that we can integrate into our Ayurvedic practice. This is about the heart shen. So the heart shen is your spirit. So when people are having, especially looping thoughts and like really circular thinking, and their anxieties through the roof, and they can't ground and they can't, stay present with you and maintain eye contact, these are all signs of that we have something that Yuanzi might be a really good add-in for. So it's very good for mental, emotional ama, especially would probably be the big thing I'd say. Sadaka pitta also, and it's a nourisher of ojas, maja, and rasa too, right? So it has this effect of helping to clear the mind, help to get the mental ama out of the way, but also, nourish and be a little bit of a rejuvenative or rasayana-like kind of property in the sense that it also gives that groundedness for people. So we can imagine what this probably does for vata, right? It's very much like brings vata down while also clearing out phlegm. Um, so whenever you see this, and I know we've all seen this all the time, somebody goes through a big divorce, goes through, a job loss or the death of a loved one, right? These are all things that will really like set off this heart spirit. So it's a heart kidney disconnect in Chinese medicine. Um, this one particularly, you do need to be a little bit careful with. They usually often will have it processed already so that it won't be as irritating. But I have seen, and this is one of the main indications of cautions, is that it can cause a little bit of throat irritation. If somebody's taking like a pill form, then you don't really have to worry so much about that. But the one thing I'd say is just watch for is throat irritation, any kind of gastric upset. If they have ulcers or something like that, you might be a little more careful, or maybe even potentially avoid it. But it's such a wonderful herb. I linked a study at the end, but they've done some cool stuff showing its increasing cognitive abilities and helping people with Alzheimer's and things like that too. So a lot of great effects this herb can have on people. Let's go to the case study. So I have 37-year-old female, anxiety, looping thoughts at night, difficulty transitioning to sleep, emotional reactivity, and concentration issues during the day. So pretty good picture of something that you might start thinking like, oh yeah, your answer might fit very well in this. So single mom with 2 kids, divorced within the year, using marijuana at night to sleep and a glass of wine with dinner daily. So we got a lot of stuff, right? She's trying to self-medicate. Usually those things will what cause more mental ama than they help in the long run, right? They give you that momentary bliss or that like disassociation, but we need to like really find ways to get a little more clever in here to help her. You can see her tongue over here. She's got a pretty red tip tongue. This is similar in Chinese medicine as it is in Ayurveda. This has to do with the heart region up here, especially. So whenever you see something like this, especially that bright red, like, okay, heart spirit is affected, right? So we need to do something for that. Rapid pulse, thin and floating, that just shows a lot of heat, a lot of vata, so a lot of vata and pitta combinations happening in that case. Not a groundedness, right? Her kidney position is not strong, it's not holding her down. Um, Her formula I built as Yuanzi is the primary herb, Brahmi, Jedamumzi, and I just have her taking it with warm water, again, mostly to keep it simple. I was having her mix it with a little bit like a teaspoon of ghee in there too, just to help modulate some of that effect of it maybe being irritating in the GI tract. Also, again, I mean, ghee is ghee, right? We all know and love ghee. It's probably just, we should all take it every day for everything anyway. But as an anapana, it's going to be really helpful to help some of these herbs also go, specifically since we're working on mental, emotional problems with her. Um, I won't spend too long. I know I want to move a little bit. So, but you can look at some of the formula logic of what these herbs do. We know Brahmi, Jadamamsidi, Shanka Pushpi also, especially for having similar effects. But Yuanzi, I think where it really shines in that collection is that helps with clearing that mental amma. I mean, I think Brahmi and it does that to some degree too, but it's a very much specific. I think it's like burning off that that fog from people's minds. Um, so my go-to for settling disturbed Shen while also nourishing Ojas, we talked about that a little bit. Very useful for insomnia, especially when there's that restlessness. And this is a big thing that I think I got a lot more out of Chinese medicine than I learned about it in Ayurveda. I'm not saying it doesn't exist in Ayurveda, but the luster of the eyes is usually a big sign that you can look at to see how intense that mental ama is. So when you see that glassed over, glazed eye look, you know that there's like that's a big problem. And the bigger the glaze, the bigger the the more I'm looking at you, but you're not looking at me. Like there's nobody in there. You know that there's going to be a big mental component there, and this herb would probably be very good to use. And then you can also balance out with the tongue coat too. So the big thick coats, you'll get into some formulas that we won't talk about today, but where you need to treat, you have a heavier job load in front of you, right? So beautiful herb. This thing's great. I love this herb. This one's probably the toughest one to find of this collection. I poked around and I did find it on, so I'll show you guys at the end, but I found out where we can get it. But consider this one for sure. I love this herb. All right, another superstar, Swanzao Rin, Ziziphus. This is a wonderful herb for a lot of reasons too. There's a little bit of similarities with the previous herb Yuanzi in that it treats, heart spirit, and it helps with insomnia, especially. Its primary indications are to treat insomnia. I like this more though when it's that wired and tired type of insomnia. So people who are like racing all day and they got the kids and they got to go to work and their husband's a jerk or whatever, right? Like all the things are kind of stacked up and so they can't turn off and they're running on that kind of adrenal fumes. Swanzaran is so helpful for this. Other indications that you can see is like night sweats, irritability due to stress, vata pushing pitta aggravation, excessive sweating from deficiency, so hyperhidrosis, things like that. This one's pretty well tolerated. It's pretty tasty too. It's like a sweet sour flavor. So if you like that kind of stuff, it's kind of fun to just eat some of this stuff and try it so you know what it's like. Let's see if they are, so since it's sweet and sour, right? We know this is going to be a pitta kapha increasing thing. So if they are very excessive pitta kapha, you might not think about this herb so much, but you could still maybe play with it a little bit, but just be mindful of doshas. Taken with SRIs or MOIs may amplify the sedative effect of these medications. So again, something to think about. We are trying to ground and help people sleep, but we don't want to ground too high. So a lot of times that's the big caution we need to look at with herbs, right? Is like, are we accentuating the effects of medications that patient might already be on? 9 to 15 grams is its dosage. This is cool, right? A systematic review of Swanzaran, that's the formula, but has comparable effects to benzos or cognitive behavioral therapy in improving sleep quality. That's pretty amazing. So wonderful herb. Think about this herb. Very easy to implement and take, and if they're going to take the powder form and they want to taste it like some crazy patients do, I'm one of those, then this one at least doesn't taste gross. All right, here's our case study. 60-year-old female with insomnia, waking at night, anxiety, night sweats, trouble settling at night. So a little bit similar, right, to that previous patient, but she's a little more just because of stress, right? Like life is just life in her. Stays up late at night watching true crime. What do we call that? Prajnaparata, right? Not a good idea. And I never do that. Never once do I do something like that. Ongoing work stress, nightmares since childhood, unrested feeling upon waking, and constipation. Her tongue, she's got a red tip here, thin coat. You can see again, right, we have some heart issues here. We know that's probably the main organ system and network we're going to have to look at. Her pulse is thin and weak in the heart and liver, not the heat, the heart and liver positions. Again, it's going to point us more towards, in Chinese terms, looking at the heart and liver. Vata pushing pitta at nighttime, low ojas just from grinding, and this keeps going and going and going. Disturbed sattaka pitta, Majja deficiency affecting sleep, nervous system depletion, right? So we've seen this picture, right? It's a very common patient. We all have seen this every day. This is called life. I built her formula. It's a little bit, you can see it's a little bit similar to our previous one. It has the Brahmi in it again. It has Jadamumzi in it again. The way I like to dose the Swanza Ren is to have them take it. That just means at bedtime. So I'm doing a big dose of it at bedtime. So 4 grams, an hour before bedtime. This is kind of that like sedative effect of, right, of like settling in. Some patients you'll see with this, if they take it throughout the day, they'll be like, I'm just a little drowsy. I mean, they'll be able to function, but it's better just to kind of hit it right at the end of the day. So right after dinner, or at least an hour before bed, something like that, do your big dose. If they need a little bit more stress reduction, or they're just a little wiry, and you could give a small dose during the day as well. But I'd start with like 4 grams at nighttime, and then have them take these other herbs during the day. We got our formula logics over here. We won't spend too much time on that. Talked about this dose at bedtime or throughout the day. Combined sleep formulas. This is just an aside that I've noticed in my practice, and maybe Melissa too, but you have to mix it up. Like the body tends to acclimate to some of these things sometimes. So I try to get people on cycles of a couple months with the ones who have really chronic insomnia, I should say. So the ones who are like nothing works and this has been forever, you can do something for a couple months and then the body acclimates. And so you got to switch signals. So I'll start with a formula that has Swanza in it. And then maybe in 3 months, I'll say, okay, let's switch it up. Let's put you on this formula. And maybe it's even something outside of our scope, right? Or, Ayurveda, like a CBD formula or something, right? Like you bounce around your sleep formulas. And in my personal clinical experience, that's how you respond the best. If you stick with one thing for too long, it stops working. So I don't know what that mechanism is exactly, but we just need to do that, has been my experience. Um, Bedtime routines are huge. We know this. This is Ayurveda 101 stuff, right? I won't spend too much time talking about that, but no true crime before bed when you can't sleep at night. Lights out, no screens in front of your face the last at least hour before bed. They say you can have a lamp behind you is okay. Read a book. What's the best way to fall asleep? Read a book. You'll probably make it about half a page and you'll be crashed out. So that's one of my favorite sleep techniques too. Um, and that's about it on this ones I ran. And then our last fearless leader, Dong Chung Sha Sao. Cordyceps. This is another one. Were you saying something, Tanya? Oh, you're just moving your lips. Okay. Um, Cordyceps. This is another one that has made the rounds and has made some, people have at least heard of this. And such a fantastic, I don't even know if we can call it an herb, but medicinal substance. And this one gets, I use it a lot for people, especially when they are very depleted with their lungs and kidney meridians. How this would look maybe in an Ayurvedic context is your ojas is going to be bottomed out and your prana vata is going to be very bottomed out. So some common conditions would be like COPD, somebody who's chronically ill, like a really low immune system where they just don't do well, low stamina. Oh, I have some of it here, I guess, huh? Fatigue, weakness, low stamina, post-viral, chronic respiratory depletion, infertility is another big one. Generalized immune weakness, chronic cough, shortness of breath, right? So aging, just part of life. But ojas depletion at the end of the day is what this is going to look like with cordyceps. So when you see that patient who looks like this and they're like struggle to breathe and they walk 10 feet and they need to take a seat, and they use a cane, or now they're in the motorized scooter or things like that, right? This can be a really good substance to integrate into their formula. Also great if you're going to high altitudes, right? So if you're traveling to somewhere, up in Colorado or something like that, right? Somewhere where you're going to be up high, this is like the herb you want to take beforehand. This will help you acclimate to that, to the increase in elevation. So similar effects to we have some herbs and substances that do this in Ayurveda too, but this one I think is just so good. It works so good. I put these two versions of it. So this is the traditional version. If you guys give me 1 minute, I'll show you the video. It's so cool. We got to see it, but we'll talk about this. So this is actually a worm. And then the fungus grows out of the worm's head. It's a trip. So it's a parasitic fungus, right? And this is something we don't talk about in Ayurveda a lot, is mushroomy fungus stuff, right? So we might get into that. But because of just depletion of resources, they now grow it. So this is a much more sustainable version. So there's Cordyceps sinensis and Cordyceps militaris. So this would be the cultivated version of it. But yeah, again, this is one of my favorite substances to use for people. I just put a woman who has COPD, pretty terrible, and she's doing great with it. I mean, it's not like turning COPD off or anything, but it's really letting her breathe and not get that anxiety that comes when you can't breathe and function and walk further and that type of thing. So, only thing to really watch for is active infections and steroid medications, because again, this might potentiate the effect of that. It's also a little warming, so people have hypothermia. So here's our guy, 38, post-viral fatigue, low libido and sperm count, weak lung capacity, reduced workout recovery, and sore low back. Classic kidney deficiency in Chinese medicine. But in Ayurveda, we'll use this and similar for like raising our ojas, low shukra dhatu, low meta metabolism, vata accumulation and prana in the apana, and overall dhatu depletion. So I got cordyceps as my big dude here. Ashwagandha, I think, is also really important for him too, right? We know this a lot for male fertility stuff. Shilajit, probably the closest thing we have, I think, from a analytical perspective to cordyceps and the function. So if you understand Shilajit really well, cordyceps is going to fit in that same category too. And then we could also throw some kapikachu too if we just want to like really take it over the top. The nice thing about this is cordyceps is heating, right? So these are pretty heavy tonics. This will help it digest a little better with the cordyceps in there. And then I like to use ginger and cinnamon tea as an anupam for anything that has to do where we need some yang tonic. These are very heating herbs, right? And again, just simple. This is a guy. You gotta remember that. Guys are stubborn, don't want to do nothing. So we give him something simple he can take so that he'll actually take this. Um, Got our logic over here of why we do cordyceps and ashwagandha and shilajit. Excellent stamina builder again. It's got a rasayana-like quality. They don't really quite have that in Chinese medicine, like that idea. Maybe there's probably in some texts there might I shouldn't say that necessarily, but it's I think not as talked about as the way we talk about it. Just dose over time and be mindful of digestion agni. Again, we're just looking at dosha stuff here, right? So we know this already. We need to just adjust with our patient what we see in front of us, not just based on what we think would be good because that advertisement said, oh, this is a great rasayana, right? We need to know, like, can they digest this rasayana? Is there amma getting worse? Like, then they're not uptaking this, right? So important things to think about that we already know. In Chinese medicine, they're big when this person has like kidney deficiency, keep very warm, wearing scarves, jackets, keeping the low back warm. That's the kidney area, very important. Tanya probably knows about this too with stuff she's doing, but that's just another little clinical thing that I'll often have people who are in this state to remember. Okay, so that's our video. Let me actually, I'll finish. Maybe I only got a couple more slides anyway, but I'll just finish it and then maybe we'll come back and watch this video or at least tell you guys about it. So just a little summary of the protocols that we learned today, the formulas, Qi and Ojas tonification, Huang Qi, Ashwagandha, Shatavari, blood and rasa rakta nourishment, where we're going to add Dongui as our Chinese herb, Shatavari and Musta, Shen and Prana Vata calming, Shen again is heart spirit, Yuanzi, Brahmi, Jadamamzi, Insomnia and Vata Pitta calming, Swanza Ren is our addition with Brahmi and nutmeg, and respiratory and kidney Qi or Ojas tonification, cordyceps with ashwagandha and shilajit. So pretty simple things, right? Like we know these other herbs really well. You can imagine how these might fit in there and be very complementary. And the last couple considerations, start low, observe the effects and adjust your dosing. So we know this, right? We're always kind of monitoring our patient to make sure they're on the right herb at the right time, right season. And you're better starting low than starting too high, usually, right? Consider patient constitution, prakriti, vikriti, and adjust the herbs as necessary. Kind of, I guess, the same idea. Monitor pregnancy. So especially things like Dongui, right? We want to say like if the patient's getting pregnant, we need to know. If there's medication changes, we need to know. We always want to look at drug herb interactions and not assume that it's just fine and the herbs will be just okay because it's not always the case. And even if it isn't that, you got to cover your butt a little bit. So make sure you're always kind of just double checking that stuff. And then of course allergies and things like that. This is where we're going to get into, which is a little bit tricky for us, but reputable suppliers with third-party testing. I have a lot of opinions on where to get good herbs from and where not to get your herbs from. Same problems in China as they have in India, where, sometimes they'll say things are in a formula that are actually not in a formula, or there'll be additions in the formula that are not listed, and sometimes purposeful or non-purposeful, but just based on the environment the herbs are grown in. They can have heavy metals in them and things in them that aren't going to be great for us to take. So you really want to be selective with the companies you use. It's super important. Just as an aside, I tend to really trust brands that come out of Taiwan more than I do the ones that come out of China. So keep that in mind. Powders and extracts, we're going to talk about just for a brief moment because that's one thing we need to think about with the way we can order as Ayurvedic practitioners. So I poked around on Amazon just to see what was available. So this is the thing. This is the problem for Ayurvedic practitioners. A lot of the companies, you have to be licensed Chinese medicine practitioners to order from them, so they won't sell to you as a Ayurvedic practitioner. I did find that Plum Flower sells on Amazon, so they're a reputable brand. It's not my first go-to, but they're good. They're fine, and I think that might be the best bet to find the widest selection. So you can go on Amazon and find Plum Flower stuff, and they have the ones there and all that. I also saw this. I don't know this company, so I haven't dug into them, but Nootropics Depot has it too. They're on Amazon, so maybe think about them. They got that nice shiny label, so hopefully they're following it up with good practices too. But check out that. And then Plum Dragon has the raw herb. If any of you guys do like raw herb creations, the one thing I want to say about this is I believe this is a concentrate. So Chinese, I wish somebody in Ayurveda would do this. Maybe this is my next brilliant business idea, but you can get Chinese herbs in concentrated granule form. So what they do is they cook the herbs down, and then I think it's like a potato starch or something they use to bind it to. So you get this kind of like granular powder stuff that's like highly concentrated. It makes it so much easier because you can get a little scooper, mix it in warm water, stir it, and then you got a drink and you can drink it. And you can just dose stronger easily without having somebody have to take like 25 capsules or whatever, right? So I wish somebody would do that in Ayurveda, but if you're going to get the granule version, um, just really like look at the dosing. So it's usually 5 to 1, meaning there's going to be 5 grams of the herb in every gram, or like the little spoon they give you, right? So if you're going to give, we did 3 grams, right? You would say, okay, so that's a little less than 1 spoon, right? Just know that if you get the granules rather than the actual herb powder itself. But this is probably the best company I could see on Amazon that you can get it from. We have beautiful stuff here in Tucson. I know. Oh, Tanya's here. Um, Yongshen's a great Chinese herbal pharmacy. My friend Kelly just bought, and super cool place. You can find this there. There may be certain formulas they won't sell to you as a non-licensed practitioner, but there are ones you can get. And they definitely will carry the plum flower line and all that kind of stuff. She does do online sales too, so you could check her website and see about that. And then there's this beautiful place, Tucson Herb Store here too, that my friend Amanda owns, and she carries some Chinese herbs. She's also an acupuncturist actually, and you can, I'm sure, find some of these there as well. So that's probably the best resources. Again, we tried to pick stuff that was like fairly widely available. So most of these, I think, other than probably the ones there, and you can find it, any local co-op or herb shop or the bigger grocery stores too. And I don't know about Phoenix. I don't know if Phoenix has a Chinese herbal pharmacy. I'm sure they must, but I just don't know Phoenix, so I'm not sure. I just linked a couple of these if you guys really want to go watch them, just or go see the studies about the different herbs we talked about. This is the main book if you want to like deep dive Chinese medicine herbs. This is the dude, Dan Bensky. This book's been around forever and it's about that thick. So it'll give you some good reading so you can really learn about Chinese herbs much more in depth. And that's it. Thank you. Here's all my links and stuff if you guys want to go check out my stuff. And yeah, it's been great. It's been great spending time with you guys. I'm
Thank
sorry.
you,
I went
Josh.
really fast, I know, and I I cram way too
Thank
much stuff, but
you.
I hope it's
Amazing,
helpful.
amazing. We need to make this that's what next maybe we'll expand. Expand, but thank you. That was amazing. That's all great information, all great ways to think about how we can utilize what we have here. We have these great tools here, and we think in a wide way with our Ayurvedic brains. We could integrate. It's actually, we use our scope of Ayurveda and we could expand how we see things. We can expand how we can see our tools. So this is such a great talk around these herbs, but also the idea of using the lens of Ayurveda to see all the beautiful tools that we could use here in our backyard, here in this country. I think it's important. So, thank you, Josh. Thank
All
you,
right.
and hopefully we'll see you again in our in our APA workshops and our APA offerings. And so, if anyone has any questions, because the time is late now, if anyone has any questions, feel free to email Josh or email us over at APA. And because, yes, because we do have to end. But thank you, Josh. And I'm
Of
sure
course. Thank
everyone,
you.
yeah, I'm sure everyone here, yes, everyone
Yeah,
says
feel
thank you.
free if anybody has a question. I know I went really fast, and so shoot me an email or something.
Yeah, yeah. Okay. Okay. Well, have a great rest of your day. Have a great rest of the week. Happy Thanksgiving, everyone. Everyone stay safe. God bless. Nice to see everyone here. Did I miss anything else? Anything else? Anyone else want to add anything? Nope. No. Okay. Bye. Thank
Bye,
you.
guys.
Bye.